This morning, the Federal Food and Drug Administration has been quite busy recently and has given physicians new tools to manage dementia, a form of pneumonia that attacks infants as well as older adults. Many are asking, what can these treatments potentially do and who should consider them? To answer these questions and tell us more about recent advances in medicine, we are joined by our medical expert, Dr. David Winter from Baylor Scott and White Health. Good morning, Dr. Winter. I first want you to tell us about Alzheimer's disease. How common is it and what kinds of treatments are currently available?
Yeah, there are about 6.5 million Americans who currently have Alzheimer's disease, and that number is growing as the population ages. There are some drugs out available right now, but they don't work very well. We got two promising ones that are coming out pretty soon. Leqembi was just approved, should come out, we hope, in the fall. And then donanemab, that's a mouthful to say, that one should be out by the end of the year. Both of these slow the progression of Alzheimer's in clinical trials, don't make it better, don't improve Alzheimer's patients, but they keep them from getting worse. Now, a couple things about them. It's an IV solution, so you have to have a needle in your arm and they drip it in over an hour or so. You have to meet certain criteria to qualify for this, and the drugs are very expensive, up to $26,000 a year. Medicare says they'll cover it, maybe 80%, so that'll help some, but they're very expensive drugs, Tashara.
Wow, that cost really does seem like is a lot for a lot of people, might limit its use. What about side effects with it?
Well, they do have some serious side effects in a minority of patients, and they include brain swelling, brain bleeding. There's even 3 deaths in both of the clinical trials, so we have to be careful about who we prescribe this for. We may have some help with a genetic marker, because if you have this positive genetic marker, you should not get these drugs. So that may be a part of the way we figure out who can tolerate them and who should not be taking them at all.
There's another Alzheimer's drug that was approved by the FDA last year. What happened to that one and what's going on with it?
Yeah, Aduhelm actually is already approved. It was approved last year, as you said, but there's a lot of controversy about the way it was approved, and right now it's under congressional investigation, so I'm not sure if that's ever going to be out. But regardless, these 2 new drugs in clinical trials actually are better than that was, so we have some better choices coming later this year.
All right, I want to switch gears and talk about this that could impact a lot of folks. How about the new vaccine for babies, RSV? Tell us about it.
Yeah, respiratory syncytial virus is what we're talking about. It's very common in infants and young children up to age 2. In fact, it tends to fill up our children's hospitals in America between October and April every year. Well, we had a drug vaccine a couple of years ago. It didn't work very well. It was taken off the market. This new drug, though, seemed to work very well. In the trials, it lowered the incidence of severe illness by 70%. So the vaccine should be out this fall. We recommend it for all young children. Older children probably don't need it. Young adults don't need it. We tolerate that pretty well, like a common cold. But it's also recommended for older adults. So if 60s, 70s, particularly if you have some kind of lung disease or chronic illnesses, you might want to consider this also. So new vaccines, new drugs coming out. I got to tell you, Tashara, it's an exciting time to be involved in medicine. We are actually preventing and treating things we couldn't do 10, 20 years ago. A lot of progress is being made.
Yeah, I tell you what, it's always a pleasure to hear you tell us all about the progress that has been made. Dr. David Winter, appreciate you joining us this morning.